Good afternoon, everybody. Today is August 12th, 2022. My name's Scott McGann with the Falmouth Health Department, doing our every other week COVID-19 update. Our website is falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So we're at 5,235 cases since the beginning of the pandemic, with 25 PCR cases during this past week and 42 the previous week. Again, these are PCR tests only, and then we had 20 probable. Those are tests that are going to our system of tracking that we've been using. This does not count home tests. There are some multiplier higher for case counts. That being said, things are a little bit better this week. And if PCR tests are down, it begs to say that also the home tests would be down. So it's a good indicator of up and down, not a good indicator of accuracy per se. So our 14-day incidence rate, again, based on PCRs, went down to 15.6 from 21.5, and our positivity from PCRs are 7.28, which is down from 9.62. So compared to weeks previous, we've had a better week. So you can see in the far right, I just did this real quickly, is that we've got a downward trend over the last couple of weeks. I wouldn't say, maybe just past week. Last week was right around that 50. We've kind of been at plus or minus 50 PCR cases per week, which might mean somewhere around 150, 250 actual cases, because most people would be going to the home kits at this time. But so these numbers since, I would say right around that January area, right after that Omicron, that home kits are the predominant. So you can kind of compare it to itself, that we were in a better spot than we were May, and sort of similar pattern all summer. And so that's kind of where we're at. In terms of hospitalizations, that's an accurate number, because if you're going to the hospital and for COVID, then that's accurate. So it doesn't matter what kind of test you got. We're in the medium, and the reason being is we're at 10.7 new COVID admissions for the county. This is county data per 100,000 population. You have to be below 10. We are less than 200 cases, so we could either be green for low, medium, or high orange. We're at 10.7 because we need to be less than 10 on that one particular number. We're definitely down. We're definitely low enough, and the percentage of beds used by patients with confirmed COVID is 3.2. So we're in what I'd call a low medium, the lower end of medium, kind of where we've been. This is actually a little bit less than where we were a couple weeks back, but we remain medium for this past week. And in terms of that, again, high, you would consider wearing masks. Medium, if you're immune compromised. There's no mandates. This isn't a mandate. This is just recommendation. And again, it's always based on personal preference. Start thinking about it as you get medium, and definitely think about it as you're getting high. You can start taking, especially if you're immune compromised, elderly, or so forth, if you're at a high risk for severe disease. In terms of hospitalizations, this is a rolling chart of the county of cases of hospitalization. So new admissions is up top, pretty flat. Daily beds used, relatively flat, maybe slightly down. Both of them slightly on the down. Same thing with ICU beds used, but that's not really make a trend when it's only a week or so. You can kind of see it. We've been pretty stable overall all summer long. Okay. The rest of the state, I saw a little bit more yellow and a little bit more green than the last time I looked at the chart a couple weeks back when I was redoing the presentation from 2 weeks ago. So you see a lot of, you see the southeast being mostly the higher spot. Again, in the summer, they're in the AC and indoors more. We're outdoors more. This will entirely flip over in the winter. As we start to come inside, they start to go outside a bit more. But we see that there's been from high, it's down 2%, which is pretty good. Medium is up 1.6. So as they've gone from high, they've gone to medium to increase medium. They've gone down more from the high to the medium. And then low is a very low number in terms of population. So. In terms of cases, this is only done weekly now. It's not done daily by the state. This is DPH's daily weekly cases. Last time I did the presentation was a little over 9,000. It's about 9,000 now, so not a huge difference. Positivity's been at 8.5, so similar. Again, I think the state's sort of a similar holding pattern. The trends all look relatively flat to slightly down, maybe on the 7-day average, slightly. So pretty stable summer, I guess I would say, with a fair amount of COVID. So I guess if I had to say, there was fairly robust amount of COVID, not making the hospitals back to 2020, and it's been pretty stable for the entire summer. This is the MWRA. This is the wastewater measurements from the Boston area, and you can see that the southern part, which would be like the Hingham all the way up to Norwood type of thing. The North Shore would be like Melrose and so forth. So this has been relatively flat to a downward trend. You can see it started headed down, but it's not sharp or anything. It's just sort of slightly on the downside over the last month or so. So that's MWRA numbers. As far as our incidence rate, we're sort of in the middle. We are at 15.6. Barnstable was at 20. Mashpee was higher. So a few towns higher, a few towns lower, somewhere in the middle. And that incidence rate basically means the number of PCR positive cases per 100,000 per day is what that means. So 15.6 is where we're at, sort of middle of the road for the county. Positivity, we're also maybe on a slightly lower side. Most of our peers were, I think, looked above us, but still all sort of in the same similar pattern for the summer. Vaccine is readily available. Okay, again, the pharmacies, go on vaxfinder.mass.gov. That's where you go for that. Any homebound people, again, if you're coming in on vacation, you've seen this, you never heard from me before. You're like, oh, where's this guy come from? And you find that your neighbor is homebound or somebody down the street, and then you've talked to them the once or twice a year. You might come down and you say, hey, and they haven't been vaccinated. You can call that health department 508-495-7485, and we'll send somebody from the VNA to take care of that. The Visiting Nurse Association can do the vaccinations. But plenty of open slots. Testing, again, is home kits. But you can have a PCR or a rapid antigen at pharmacies and in Convenient MD, the hospital. Most people are using the home kits, which is great, but home kits are not on our radar for case counts and so forth. A little bit of change in the guidance. The state hasn't done anything with this yet, but this came out, I believe, yesterday. Those that weren't up to date on their COVID-19 vaccine. The unvaccinated only got one dose of the 2-dose regime or didn't get boosted would have to quarantine if they were a close contact for 5 days, and that's gone out of the CDC guidance. The state's website as of this morning hasn't changed. So if you were exposed to someone with COVID-19, instead of quarantining, you would wear high-quality masks for 10 days and get tested on day 5. If that's for those in contact. Again, you quarantine when you're a contact, you isolate when you're a case. It's similar for the cases. It hasn't changed. If you're positive for COVID, you're out for at least 5 days. And again, if you're fever-free without use of medications, your symptoms are improving substantially. No new symptoms. You can end isolation after day 5, and then you would wear a mask through day 10. That's the same. It was just if you weren't vaxxed or you weren't boosted, you would be out if you were a close contact. And that's changes in CDC. I haven't seen the state in that. Again, how that works is the CDC would send out guidance and the states would choose whether they want to adopt them. As of this morning, I didn't hear anything from the state regarding this. That may change by the end of the day. I'm not sure, but that's where we are. Again, I go on mass.gov like the rest of you unless I get an email. Vaccinations, we added 167 first, second, and booster doses, 55 new, 40 second, 72 boosters, and that's for a 2-week time frame from the 25th to 8/8. So I think anybody who wants to get vaccinated or has already made that choice. As far as what variant, BA.5 is the darker green, and that's definitely taken over between that and BA.4. So original Omicron's dark purple, it only shows up in a sliver back in May. The BA.2 took over. That got wiped out quick by the BA.2.12. That got wiped out quick by the BA.5. So the predominant strain is definitely BA.5, which causes a lot of, which is highly spreadable, and that's why we saw, we see that sort of steady, moderate amount of COVID to high amount of COVID compared to what we would see in previous variants during the pandemic. But the hospitalizations aren't going up proportionate to that because we have vaccine boosters, treatments, so forth. So as a recap, Falmouth case counts are stable, but sorry for the spelling error, trending a little bit downward. Hopefully it stays that way. The county CDC measurement is medium base, so we're yellow medium. Plenty of vaccine and testing capabilities. The booster's available. BA.5 is the dominant strain. There are no mask mandates. There is a town advisory through the select board in town-owned properties. They do advise. They have not taken that off. Again, your individual circumstances dictate in situations that you're in would determine whether you want to wear a mask or not. Some people are, some aren't. Again, there are changes to the quarantine rules per CDC, not state taken in yet. Is that those are exposed that are not fully vaxxed, do not need to quarantine if they're not fully vaxxed anymore. See some spelling errors, sorry about that. I wrote that up quick. So that's what I have for a recap on COVID. It's very, very, very stable this summer, stable on the high side. And it looks like it's a little bit downward this week, and hopefully it just sort of continues to trend that way. And we'll be doing these every couple of weeks, so I'll see you in 2 Fridays, and everybody take care. Thanks.